Hi, you guys. Welcome back for our daily practice questions. It is day 28, and as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 64-year-old patient with moderate COPD stage 2 presents with daily symptoms of shortness of breath, cough, and sputum production. They have frequent exacerbations and require treatment with a SABA multiple times a week. What is the most appropriate treatment for this patient at this stage? Is it a short-acting beta agonist as needed, B, a LABA, C, a LABA plus ICS combination, or D, a SAMA as needed? Take a moment and tell me what you got in the comments, y'all. All right, so y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you are answering what is truly being asked of you. So here, the stem of the question states, what is the most appropriate treatment for this patient at this stage? And y'all, I always tell y'all, if they're looking for the treatment, run it back and see if they have provided you with the diagnosis, right? But in scenarios where they're asking you what is the most appropriate treatment at this stage, most times than not, they have provided you with the diagnosis and you are determining whether you need to adjust, add things on, shift, what have you. So in this, they have provided it COPD. This is stage 2 of COPD. This patient continues to have symptoms. They are on the SABA therapy currently. But what do we do in COPD stage 2? And this is why I tell y'all, write those charts down daily. Write it out so that you can see it. And I want you to slow down and visualize stage 2. I want you to slow down and visualize what puts them into stage 2. And do all the things so that you're not getting overwhelmed or thinking too quickly and mixing up the different stages, right? So in stage 2, stage 1 of COPD, we start with just a short acting as needed, right? Because we're always going to have our rescue style inhaler on board. So that's that SABA they're talking about. So we already have that. And now that we're in stage 2, we need to add in this long acting. Remembering in stage 2 of COPD, we do a short acting for rescue. We do a long acting. If it's flu season, we're going to give that flu vaccine. And I tell y'all to think about pulmonary rehab being 2 words. So we do that in stage 2, right? So the best answer here is B. We want to make sure that we add in that LABA at this point, okay? And be careful so you're not mixing up asthma and COPD. Pay attention to what they're asking you. All right, question number 2. A 35-year-old patient with asthma is on step 2 of the GINA guidelines using a low-dose inhaled corticosteroid plus a LABA combo inhaler PRN, but they still experience symptoms such as coughing and wheezing several times a week, with nighttime awakenings occurring more than twice a month. Based on step 3 of the GINA guidelines, what is the most appropriate treatment next step for this patient? Is it A, to add a low-dose ICS plus a LABA daily? B, increase the dose of the ICS? C, switch to a combination inhaler with both a LABA and LAMA? Or D, add a leukotriene receptor antagonist? Take a moment and tell me what you got, you guys. All right, so stem of the question here states, based on step 3 of the GINA guidelines, what is the most appropriate treatment next step for this patient? 1, this stem tells you everything. What do we do in step 3 of the GINA guidelines? In step 3, we do the low dose ICS and LABA combo inhaler daily, right? That's where the maintenance regimen starts in step 3, right? But even if you don't know that, let's process it through, right? So we have a 35-year-old with asthma. They're in the step 2. They're currently on the step 2 of the GINA guidelines, where they're using that low dose ICS plus LABA PRN. Remembering that in step 1 and step 2, that's where we utilize those PRN, right? But they're still experiencing symptoms such as coughing and wheezing several times a week, with nighttime awakenings occurring more than twice a month. So that means they're still not controlled. So what do? We're going to step up and bump up the GINA guidelines stepwise approach, right? And we're going to take them from an as needed low dose and now put them on a low dose combo inhaler of the inhaled corticosteroid plus the LABA daily, okay? So A is your best answer. And then lastly, question number 3, a 60-year-old patient with a 30-pack year smoking history presents with chronic cough, sputum production, and increasing shortness of breath, especially with physical exertion. You perform spirometry, and the results show an FEV1 of 55% of the predicted value with a ratio of 0.65. According to the GOLD guidelines, what is the most appropriate stage of the COPD for this patient? Is it A, stage 1, B, stage 2, C, stage 3, or D, stage 4? Take a moment and tell me what you got. All right, so similar question states, according to the GOLD 2021 guidelines, what is the most appropriate stage of COPD for this patient? All right, so let's go back and work our way through. So this is a 30-pack year history smoking patient, right? They have a chronic cough, sputum production. They have all the symptoms, right? Spirometry and the thing, and I did it this way because boards will add all this stuff in here and you will get flustered and sometimes forget what you know. So I wanted to give you something with a lot of detail and then show you what to pinpoint, right? So we still want to pay attention to that FEV1. FEV1 of 55% puts you into what category according to the gold standards on COPD? And I do have 2021 on here because that is what we're still testing on until the test updates or anything changes, okay? So again, as I always tell y'all in the beginning, I give you the questions to prepare for the current test that they're testing you on, okay? So according to those guidelines, what stage are we in with the 55% FEV1? Because that'll take you straight to it, right? Don't worry about all the extra fluff in the scenario. So stage 1 is what? A FEV1 greater than 80%, right? Stage 2 is anywhere from 50 to 80%, right? That's 79%, right? So that's where 55 would fall in between, right? So your best answer is B, stage 2, the moderate stage. And remember, then you would go down some more. Stage 3 is anywhere from 30 to 50%. And then stage 4 is anything less than 30%, okay? But again, the best answer here is B, stage 2, that 55%, so let you know that they're falling in between that 50 to 80 range, which is stage 2, according to those gold standards. All right? All right. I hope you found this helpful. A few things. Continue to write those charts out. Every day for your asthma and your COPD. I promise this will help you. Because again, what do I always tell y'all? Repetition is the key to retention. Write it, look at it, rinse, repeat, right? And then make sure that you're differentiating one versus the other. So when they say gold stages, they're talking COPD. When they say GINA, they're talking asthma, right? GINA is just simply an acronym for the Global Initiatives for Asthma. Now, we'll continue to do a mix of these for the rest of this week to make sure that you're tying together your respiratory things. If y'all have questions, feel free to reach out and let me know. But as always, I hope you found this helpful. Please be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, feel free to reach out to the Nursing Studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to thenursingstudio, the number 1 at gmail.com. Everything that I offer is linked in the bio of this channel, including my website. And if you're looking to book any of my one-on-one sessions, in-school tutoring, or any of my custom packages or plans, I always say either call, text, or email, as I prefer to speak with you first to gauge what you need to make sure that you're booking the appropriate session type. All right, you guys. Y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.